Hi everybody, I'm Ed Baker, and it's my pleasure today to welcome you to ARC, or the Addiction Recovery Channel. ARC is a channel that's been created for people with substance use disorder. This channel is devoted to bringing you accurate information, vetted, accurate, current information that pertains to the disease of addiction, recovery, and treatment. It's a channel for anybody who cares about this, for anybody who may have someone in their family with substance use disorder, for alcohol counselors, drug counselors, social workers, medical providers, anybody who wants to really learn accurately about what this disease is all about and what we can do about this.
Stigma is the hardest thing for our patient and people in employers as well that work in this field. And what I mean by that is people are judged for something that has happened to them. This is a disease. It has no barriers. It can affect anybody at any time in any place. No one usually just wakes up in the morning and says to myself, I'm going to use heroin. It doesn't start that way. Most of the time in this day and age, it starts with prescription pills. So what I've been doing, a big purpose of what I've been doing, is trying to educate the communities, trying to educate our patients, people that we work with, about reducing this stigma.
It's estimated today that there are approximately 23 million people in recovery from addiction. What's interesting is that this has been a relatively silent population up until recently. More recently, people in recovery are speaking out.
So it took many years for me to reach what I like to call a breaking point or a rock bottom. And basically for me, that looked like desperation. I was desperate to, overcome what I was dealing with, the depression, anxiety, and move on with my life and be able to do something positive. And so I had struggled with addiction since I was, around 13 or 14. And as a lot of people say, it started with smoking pot and, and alcohol and those kinds of things, and then eventually progressed throughout high school and then also into college. And I had a few run-ins with the law in high school, nothing too serious, but most of all, I realized the problem was inside me.
When I became state's attorney, and frankly, when I was a deputy prosecutor, I dealt with a lot of folks who were involved in the criminal justice system that I knew. Okay. I grew up here, knew them. If I didn't know them, I certainly knew somebody who knew them, or I knew where they were from. And my experience of having grown up and, engaged in those same formative experiences that they did, and at some point in time, our paths diverted. They didn't divert because I was better. They didn't divert because I was special. They probably diverted for a whole set of complex reasons. One being opportunity, two, resources, three, role models, if you will. All that, frankly, I had, and looking back, I know others didn't. Here's the thing about jail. They're gonna get out. The vast majority of people in jail are gonna get out. And it's in our collective best interest as a community to make sure that people who are incarcerated have a successful reentry back into our community. That's what's in the interest of public safety. Talk about housing, talk about education, talk about jobs. None of that matters unless they're healthy. Because as you know, if somebody is using, they're not making those rational decisions. They're a risk to themselves, they're a risk to the community. So I do think that we should have medically assisted treatment available to folks in jail. Look, the Department of Corrections has done a good thing. They're extending the use to 120 days. Frankly, I think we should be looking at And my understanding of the policy is that you have to be currently in treatment on the outside in order to be to have the treatment continued while you're incarcerated, and that's fine. I support that. I also think we should consider starting treatment for people in jail. I think jail can have a powerful effect on people to really do some self-examination, and perhaps that's an opportunity for people to say, I'm ready. I'm ready to make a change.
Not everybody does well in any kind of medical treatment, but people who do well, they stop having the cravings, they stop having that, and they begin to function in a way that they restore themselves to their previous state of being, and they feel like they're in recovery, and they do activities, and they become normalized in a way. And then if they want to wean off because they think they've been good for 20 years, maybe they are. Maybe they sprain an ankle in a basketball game and some ER doc gives them a pill or two and they're off and running again because their brain's been recharged. So I think the point is that it's long-term changes that often occur that's very frustrating for people, because if I'm your partner
Sure.
and I'm like, listen, you've
Sure.
you've been da-da-da-da-da, and you're like, oh, I don't want to use, and you do, how do you get around the being angry and blaming the person for something that may be a biologic change?
And that's really the point, that it's not a choice. Given the choice, nobody chooses, I'm going to grow up and be an addict. That it's a brain disease. It's a powerful brain disease, and it's a chronic disease. It can last a lifetime, but also it responds really very favorably to the correct treatment. Sometimes medication, all the time psychotherapeutic supports, and all the time adequate recovery services. I mean, I know many people who have been in recovery for many years, and I've known people who have relapsed and gotten back into recovery. So when we have this kind of approach, then our response as a public is compassion, inclusion. Vote for the people that are going to put money into the programs to provide adequate services to help these people. If we don't have adequate information, then the normal response is, as you say, punitive, anger. I'm going to modify your behavior. I'm going to punish you until you stop.
Right.
And we'll put up some slides for public information as far as getting help for people with addiction. But what I'd like you to know, what I'd like you to take away from the program, is that there are many people out here who care about you, like Cliff, like myself, like Channel 17 for giving us the time to have this forum to try to reach you. We understand also that it's not easy. I don't want to give the impression that I think it's easy to break through shame or break through reluctance or break through fear and expose that vulnerable part of yourself that needs help. We know it's not easy, but we would just ask you to listen, to feel the message that we're trying to communicate to you. We do care, and we want you to reach out when you're ready, and we'll be here for you. Thank you.
Thank you.